Welcome to another episode of Cancer Tamer. I'm your host, Dr. Charlie Ferrer. And today we have a wonderful guest, Mary Solomon from Project Renewal Scan Van, and we're going to learn all about that. I want to give a big shout out to our co-host, Deborah Santulli-Barone, who's not able to be here with us this week. Her mom is not doing very well, and so we want to send our love and our prayers and our blessings to her. So thank you so much. Mary, for being with us, and I want to talk a little bit about the Project Renewal Scan Van, and if you can tell us what exactly that is.
So the Scan Van is a mobile mammography program. We provide screening mammography and clinical breast exams on board a 40-foot van.
Wow.
That travels all of the boroughs.
And it's not that they get in and they travel the boroughs.
No.
It's not that. You travel around the boroughs in their neighborhood.
That's right.
And then they can come in and enter
right.
the van.
We work with about 250 different community organizations throughout the city to bring the van to their neighborhood.
Excellent.
And so our calendar is generally put together about a year in advance.
Okay.
And women are welcome to join us at any one of those locations.
Awesome. And I know that you're going to be at our event coming up June 12th and 13th at the Staten Island Museum,
Very
where
exciting.
we're doing the Celebrate Life event for women with breast cancer and their loved ones, and even doctors and nurse providers would be welcome to come. I want to know a little bit more about how the program works. What do they need to do? Do they need to sign up, or do they see your van and just knock on the door and able to come in?
We prefer that women do make an appointment prior to their visit.
If they know you're in their area.
Right.
Okay.
So usually some outreach is done, local outreach is done to alert women that the scan van is coming. There's a toll-free number that women can call, and they can find out where the van's going to be and arrange an appointment that's convenient for her.
Excellent. And so then you said they do a clinical exam, so they actually do a palpitation and touch.
We think this is a very important piece of the program.
Okay.
It is performed by an RN. It's a one-on-one moment for a patient and a clinician.
Okay.
So women might have questions that are very specific to her own anatomy that she can then ask the nurse. And I think it's also a wonderful moment where our nurse has an opportunity to teach women about how important it is to maintain breast health throughout the year.
Awesome. And are these available in Spanish and English?
We have Spanish speakers on board and English speakers on board. Now, we do work with different communities throughout the city, and as you know, we're quite diverse here in New York.
Yeah.
So on some occasions, we may have a Chinese speaker on board, a Korean speaker on board, someone who speaks Polish or Russian to help us. These community liaisons are, again, extremely important to our program because it literally, it opens the gates for women to feel comfortable and come to us for their exam.
And I know when I was younger, and I'm Spanish, and my mom would always take me as an interpreter, you know,
Yes.
and not that she needed the interpretation, but she would lend me out to everyone else who needed, you know,
That's right.
to everyone else working. And so you can take your child, or not your youngins, but your teenagers with you to be able to help, to be able to just interpret.
Right, we do send paperwork home prior to an appointment so that their family members can help them fill out the forms and be more accurate with the information we're looking for.
Awesome, awesome. And how are women referred to this program? You mentioned the community services, so or they can call your number. Is there any other way of being referred?
Women are allowed to refer themselves to our program once annually. Women normally would have to get a referral from a primary care physician in order to obtain a mammogram in another facility. But
they
the
don't
New York
need that.
State Department of Health recognizes the kind of program we are, and we get a special dispensation from them every year that allows us to accept women on a self-referred basis as long as they haven't had a mammogram in the past year. So women 40 and older that have not had a mammogram in the past year need not worry about seeing a PCP first. they can come to us directly. This is often a huge barrier for women. They not only have to perhaps pay for their mammogram, but now they might have to pay to see a PCP in order to obtain that script for the mammogram.
Right, and the PCP is their primary physician.
I'm sorry, yes.
Okay, and so what I like about that is the fact that, you know, most women don't have a primary physician. They kind of, and if you haven't been doing it, you need to be checking your breasts to make sure. I know I found my own lump in my breast, and about 80% or more of the women that have been diagnosed with breast cancer actually find their own, as
That's
opposed to the doctor finding it. And so it's one of those where you find it, you find out where the next mammovan is, and if you don't have health insurance, go sneak to the other county, you know, and do that. But being able to do that, the one thing that I like about your program is you also have a follow-up, right?
Right. So the most important piece of our program, in my view, is when we have an abnormal mammogram or an abnormal clinical breast exam, for that matter, or both, the patient will get a call from one of our navigators. And the navigator will explain the result to the patient, make her understand the need for follow-up. And if she doesn't have a doctor to help her arrange appointments, we do. So if in fact there's need for follow-up, and for example she may be uninsured, we are very fortunate to be part of what's called the Cancer Services Program here in Staten Island, which means we can afford our patients not only the free mammogram and the free clinical breast exam, but also free diagnostic workup. And the workup is done at Regional Radiology, or it's done at Staten Island University, or at Rumsey. So there are choices depending on where she lives and what her needs are.
Yeah, and they're wonderful, you know, the fact that you have that connection here on Staten Island is so important, because most people don't realize that here on Staten Island we have 18.6% higher rates of breast cancer than all of New York City combined. And so it's important for you to go and get yourself checked out, not to go, oh my God, I'm gonna have breast cancer, but to be able to do some preventive care. Right. So that if you know that you may be susceptible because you're here on Staten Island, then being able to start reducing your risks, being able to learn how to keep yourself safer, to be able to do more, you know, more creative nutrition, to do some creative health exercises and things like that to keep you better.
We may not be able to prevent breast cancers from happening today, right. But what we can do is we can reduce the mortality by finding her breast cancer early. We don't want her to wait until she can feel something. We want her to come for an annual exam feeling well and fit. Most of the women that we diagnose with breast cancer have no idea they're harboring disease. Most of the women that we find have hidden breast cancers. And that's exactly what we're looking for. We are searching for something she knows nothing about. That is the most curable form of breast cancer, more likely because it's usually a very early breast cancer.
Right.
So women that are 40 and older should have an annual breast exam and an annual mammography so that we can uncover something that she couldn't possibly feel yet.
And so do you also do younger women as well, if they want to be tested?
If women are under the age of 40 and they have a strong family history, or perhaps they have a finding, or a personal history, we don't want them to hesitate to give us a call. We may not be their solution in terms of the venue to have her exam done. However, we do have ways to get her funded for free services.
Okay.
So it may not be appropriate for a young woman to have a mammogram because mammography is not the end all when it comes to young breast tissue. It truly is a very poor exam for young breasts. Yeah. So we don't encourage young women.
But if you do have a family history, or there's a, or you find a lump or something.
Right.
And the reason I'm saying that is we had a previous show with Arnaldo Silver, who actually is from the Bronx, and he was diagnosed with male breast cancer. And he insisted that his daughter be tested, and she was in her 30s at the time. And the doctors kept saying, no, there's nothing wrong with you, you're fine. But on his insistence, they did the mammo and so on. They actually found her at stage 3.
Wow.
And so she would have never gotten treatment before time. And so just that advocacy that they did for themselves. And the beautiful part was that mother, or father in this case, and daughter actually went through chemo together.
Wow.
And they're both doing well. So
Thank God.
big shout outs and hugs to you guys. The one thing that I do find, I wonder if you guys do just a little bit of education, and you don't have time for counseling, but being able to reassure the individuals that just
Sure.
because you have this doesn't mean you're going to get it. You're not going to die. So breast cancer is not a death sentence as it used to be. A couple of decades ago. There's a lot of treatment and new therapies that are being done.
Most women will survive their breast cancers and die of some other natural cause today. So women that are diagnosed in the year 2021 and 20 will go on, most of them will go on, the vast majority of them will go on to live normal, healthy lives. The wonderful thing about breast cancer is it attacks a gland that we can do without. So if you take a little piece of my breast, I can still survive and I can be a healthy human being. It's when cancers attack vital organs.
From metastasis perspective.
This is when cancer is a dangerous thing. When it attacks the lung or the brain or the bone or the liver, now we've got trouble because we need these things in order to survive. The fact is if we can find breast cancer and contain it, not allow it to metastasize, the chances of her living a very healthy, normal life is very good. My mother is an excellent example of that. My grandmother was another excellent example of that. Both women.
And this is the one thing that and you don't do genetic testing on your van.
No, we don't.
And the only objection that I have to genetic testing is not to get it. It's not to let the fear of it get to you. And by the fear, I mean, if you have been diagnosed with the breast cancer gene, it's not actually a breast cancer gene. It's just that this gene has been shown to be associated with and seen in many women that have had breast cancer. It doesn't mean run out and get a mastectomy. It means to be more conscientious of the fact that you're susceptible. And so being close together, and you guys know before I've talked about the fact that just because breast cancer runs in the family doesn't mean that you're going to get it.
Does not predict a breast cancer.
Exactly, and don't get stuck on the, oh my gosh, it's in my genes, and therefore everyone in my family is going to get it, or my mom or my son. It's being very conscientious of don't let fear attack you and make things worse.
Right. You don't want to be a deer in the headlight, but you do want to be an educated woman in that if you are at high risk, then it behooves you to enroll in some sort of surveillance program so that we can catch and find disease before it becomes difficult to take care of.
Right.
So women that are at risk, and I am one of them. I have a grandmother, a mother, and a sister all diagnosed with breast cancers. That puts me at a higher risk. Does it predict I will develop a breast cancer? Absolutely not. Okay. And in fact, in my family, there is no genetic mutation that we know of. Right. Today, we know of a few we know of a few genes when mutated can put you at risk for developing breast cancer. But we don't know the entire genome.
Exactly.
There's probably other factors out there.
And the other factors too to consider are the environment.
Surely.
Because I always say, well, if it's supposed to be a genetic thing, then my cousins in Florida should have it, and my cousins in Virginia, and my cousins in Puerto Rico, and if they don't, then it's not a hereditary thing, it's an environmental thing.
Or a combination of them.
Or a combination. And so being conscientious of what you see.
But it does mean that we must understand what risk means and how we can use that in our favor. If we know a lot, we can usually protect ourselves better.
Yes.
So if you are a woman who had a mom that developed a breast cancer, or a sister, for example, that developed a breast cancer early in life, premenopausal, then you need to be on your toes earlier than most.
Yeah.
So women
And
need
protecting and protecting your health from the perspective of, are you eating the bad kind of foods like pop? And not pot. Pop, like soda. And so being able to realize what you're eating, what you're putting into your body. I mean,
That's
after
true of any disease.
Yeah, and it's one of those things, before you get the disease, you should be doing this.
That's right.
Because one of the things that I did was, after I had gotten diagnosed, I mean, I used to eat whatever I felt like, but afterwards I became very conscientious of what I was eating and what I was putting into my body. And people hate to go with me grocery shopping because I actually read the labels.
That's right.
And I start looking for the bad stuff.
Yeah.
And if it's there, I don't eat it.
Well, it does
and you
pay
can
to be...
you can find foods that are healthy for you.
Yes, it pays to live a healthy lifestyle. If you're drinking to excess, stop. If you're smoking, stop. If you are not exercising, get out there and take a walk. If you are not eating well, learn how to eat well. Fruits and vegetables, whole foods are a better choice.
Yeah.
So if we could live a healthier lifestyle with or without living with disease, it's got to help.
And we have to choose. We have to make that choice.
Absolutely.
And actually be conscientious of it. I always say, if realizing that every moment you're making a choice. If you want that pop, the soda, if you want it, then realize, there's a lot of sugar in this. And so
my walk needs to be longer.
Yeah, my walk needs to be longer. Or should I substitute for something else? Mm-hmm. Do I really want to eat those chips, or do I want to get my sugar from a natural source like fruits and vegetables and that sort of thing? So being very conscientious of what you're doing, and the fact that you are making choices, whether or not you say, oh, well, it's in my DNA, so there's nothing I can do about it. Well, yes, there is. You have a choice.
I agree.
Now you're making the choice of, do I eat healthy? Do I exercise? Do I live my life a different way? Do I go in for periodic or
Yes.
yearly exams to be able to catch and detect anything? Mm-hmm. And if there is something, do I need to go and do my research to find something else? And realizing too, I'm very big on how you go into exams and think of things. And so, for instance, because I have a weird mutation in my CHEK2 gene, which I consider myself an X-Men now, because it's a weird mutation in my X gene. Being able to know that I have to be checked every 6 months, but I don't go into the exam every 6 months going, oh my God, are they going to find something? What's going to be wrong with me? I don't go in there that way. My attitude and my thought in my head is, I'm going to show you there's nothing there. I'm just, I'm coming in, I'm letting you know there's nothing there. I know there's nothing there. Let me show you.
Well,
that's the mindset of what you go in as.
Yes, I think part of overall health is an attitude, a mental attitude. Being able to de-stress your life and to live a happy life rather than a stressful life. Life is too short.
Yeah, it's too short and too long.
Too short.
It's too short to not take care of yourself and too long to be stupid.
Right. Don't suffer the fools. You should live a happy life, a contented life, and doing preventative exams, I believe, can give you that sense of wellness. A sense of wellness is an important thing to have.
Yes. Definitely. And it keeps you feeling stronger. And if you are having issues, which the van allows you to be able to do this, but if you need actual care, then you need to go to your doctor, you need to go to your primary care. And you said you also help them to be able to connect them to another program.
That's
or
right.
even start them on in connecting them with Health Plus or Fidelis or whoever it is, whatever programs are out there, there's a lot of them, or Medicaid or something.
One of the wonderful things about our program is we're very well safety netted in that if we do find a breast cancer and a woman is uninsured at the time of her screening, we do have a special application that comes to us through the Cancer Services Program of New York State for complete Medicaid coverage for that patient for the next 5 years. Awesome. And if she's uninsured and insurable, we are going to be able to put that application into Albany and get back an answer within 10 business days.
That's wonderful.
So we can get her into treatment in 10 days.
Immediately, which is a big thing.
It's huge.
And we did the play last year, Breast Cancer Diaries, and one of the things was that I had to wait 45 days in order to see a doctor after I found the lump in my breast because I wasn't insured. You end up where you work for yourself, and $500 a month is
no
too
woman
much.
should ever
Nobody.
feel that way, and
So,
that's one of the reasons why
yeah.
we're here. No woman should feel there's no door open to me. The door is always open, and it's
Excellent.
open fairly immediately. If you called us today, we could see you tomorrow, as long as you're willing to meet the van.
And you'll be able to get their information if you go to our website, www.cancertamer.org. We'll have a web page up for the mammography van, so look under mammography van. And you'll be able to also see this show again and again because we love it. And if you have any questions, by all means, email us at info@cancertamer.org. So you'll be able to get information. You'll be able to have a straight link to the van, Project Renewal Scan Van program. One of the things that I do want to make a big notice of and acknowledgement of is the sponsors for these programs.
Right.
Because our sponsors often get overlooked. We have these
Right.
great programs that are going and nobody knows who's sponsoring them, and this is the beauty of it. People and companies and such get behind individuals. Like for our event, the Celebrate Life conference coming up June 12th and 13th at Staten Island Museum, it's being sponsored, the van is being sponsored by Senator Lanza. So we want to give a big shout out to him. So who sponsors your program?
Well, we have several sponsors. In fact, almost 50% of the cost of our program is supported by private foundations. The leader is Judges and Lawyers Breast Cancer Alert. They call themselves JABCA. They're a wonderful organization of I just mentioned Judges and Lawyers who provide us with funding every year so that we can continue our work throughout the city. We receive a Komen grant every year. We receive a wonderful grant from Richmond County Savings Foundation right here on Staten Island. Another very big sponsor would be the New York State Department of Health and the CDC provide us with a great deal of funding for our program. So as I say, almost more than 50% of the revenues that we need to keep operating come from organizations and foundations and grants that actually are really our lifeblood. I call them the wind beneath our wings. Without them, we don't exist.
Yeah, and it's so important to get involved to help organizations like this. One of the things I see often is a lot of support goes out to places like the American Cancer Society or Susan G. Komen, but realizing that there are smaller grassroots organizations in your area that need your support as well and are also doing wonderful things. Cancer Tamer is doing one. There's other organizations here on the island that help women out. I know the Rotary also helps nonprofits get funding that they need. So being able to connect with different organizations is really important so that you not only help that organization, but you're actually helping the women that organization serves.
That's right. And our wonderful friends at Senator Andrew Lanza's office, they have been terrifically supportive in that they go out of their way to provide us with a spot to put the van once a month. Sometimes twice a month. They'll bring us to the mall.
Yeah,
4
I was going to
times
say
a
you
year.
were in the mall.
Yeah,
I think it was last month.
They are absolutely committed to making sure that their constituency is provided with a free service like this, and my hat's off to them.
Yeah, same here. Because they're supporting the conference in June, and so it's that piece of where we went to them and said, can you help? And they're like, hey, do you need a van? Yes, a van would be awesome to bring it through. The other piece on the van that I know becomes an issue is the privacy. is there privacy on the van for the women?
It's wonderfully thought out. There are two separate entrances in the front and two separate egresses in the back. So you can enter on either side of the van and you can leave from either side of the van. The front room is a reception room, and that room you'll see our receptionist who will go over the paperwork with you. You might be seated with 3 or 4 other ladies in the front room. The middle room has a door between them. That is where the x-ray takes place. You'll be greeted by an x-ray technologist, a mammography technician, who will actually take the images. And then there's a separate room in the back, and that's where the nurse does her thing. She does a clinical breast exam and education back there. We also provide colorectal screening to women that are 50 and older, that haven't been screened with a colonoscopy in the last 5 years. She'll teach you how to use a simple fit kit and send you
like the
off
one you
the
see
van.
on TV?
That's right, and she'll send you off with that little kit. You'll do the test at home. We'll report back to you the results. If you need a colonoscopy, we will set that up for you too, at no cost if you're uninsured. And when you're done in the back, you leave through the back door. So it's a constant flow of women. The only time you see each other is in the front, but otherwise it's private.
Excellent, excellent. I know the one thing that we were joking about was the fact that if you're at the conference and you're scared to go to the van, because sometimes you're scared that, oh my gosh, maybe they'll find something. And so knowing that we have a volunteer that's going to walk you to the van. She won't be there with you unless you need her to sit with you, but your staff is there to sit and talk and so on. But we'll walk you to the van and have fun doing that.
We often find it's an interesting thing. Women's health, I think, is very different than delivering male health. We are very, we're team women. Women are a team. We like to do things together.
Yes.
We often find women coming together to their appointments. They bring their sister or their best friend. They literally come on board walking hand in hand. Yeah. They need to separate at the door, but they walk in hand. This is the support that women can. And I can tell you, the outstretched hand of a friend or a sister or a mother and child is much more powerful, in my view, than a clinician saying, you need to get a mammogram.
Yeah.
I know doctors that'll get on their knees begging their patients to get their mammogram.
But
if her sister says, come with me, it gets done.
So we're going to be wrapping this up. And so the one last piece that I want you to know is that in New York State, the law is that your employer needs to give you 4 hours a year to be able to go and get a mammogram. So this is a wonderful opportunity to go and get yourself tested once a year. You can't use this excuse all the time. Once a year for 4 hours is required for you to get your mammogram. And so this is one of the wonderful things that we say, hey, you can use 4 hours to go to the conference, 4 hours to go to the van. Not that it's going to take 4 hours, but the fact that you are allowed by law to use 4 hours paid leave to be able to do this. And don't be surprised if your employer says, hey, I want a doctor's note. You can do that.
We'll give you one.
They'll give you one. They'll give you a little sign that says, here you go. I was at the mammo van. So thank you so much for watching. Remember to go to info@cancertamer.org if you have any questions, and go to our website to check out more shows and more information. Thank you so much for watching. I'm Dr. Charlie Ferrer with Cancer Tamer.